So, hello, Dr. Tacita, and hello, everybody who's here. I just want to introduce myself for those who don't know me. I'm Arielle. I'm the CEO and co-founder of Mama Soul, a 100% mineral sun care brand that I developed when I was 5 months pregnant with my first son. I started researching ingredients to avoid when you're pregnant or nursing because they are endocrine disruptors, especially. And I could not find one that I loved and looked forward to using. Um, so at Mama Soul, we're not just about formulating sunscreen. We're about creating a meaningful community where everyone here can can connect and have a passion for wellness and spirituality and connection and also
Mm.
health. So I'm bringing incredible experts like Dr. Tacita to the forefront each month, and so you can speak to her directly. So this is very different than a podcast. It's interactive, and we want you guys to be able to speak with her and get your answers in real time. So without further ado, I want to introduce Dr. Tacita. She is a naturopath and hormone specialist with over 20 years in holistic health. She's a function and regenerative medicine doctor. We're going to start off this discussion by talking about Dr. Tacita's personal journey and her motivation for entering the space and making it her life's work. But first, Dr. Tacita, can you explain to those who don't know what is function and regenerative medicine?
Yeah, so functional regenerative medicine, I'd say, is sort of newer terminology that really is trying to capture and explain root cause medicine. So, as opposed to saying, okay, your blood sugar's high, I'm going to put you on metformin. That's going to kind of suppress the issue, but it's not actually changing the person's function. It's not regenerating anything. It's not actually healing and fixing. It's reactional. Functional medicine, which really is naturopathic medicine, is looking to get to the foundational root cause of disease and ideally help to fix it, to get the body to heal itself, or at the very least improve the function. So
Could you, first of all, that's how I want to live my life.
yeah,
I feel like, for so long you go to the doctor, they prescribe antibiotics, you're just treating the problem. You're just treating the symptoms, you're
symptom
not treating the problem.
exactly.
So could you share your personal health journey and how it led to you to be specializing in hormone health?
Sure. Yeah, I'll try to abbreviate it. Basically from a young age, so like young teen years, as hormones were kicking in, started experiencing some problems. So, it started out as really heavy periods. And when you're, 14 years old, you don't really even know what is normal. So it was just sort of like, okay, well, this is what happens. And um moodiness was kicking in, more than I'd say just the average, kind of puberty picture. And I can remember telling my mom, like, I just wake up feeling like in a bad mood and I don't want to, I don't know why. I'm not trying to feel this way or act this way. And then pain started kicking in. Like any good mom, she took me to first the family doctor and then an OB-GYN doctor. And there's just like, oh, honey, you just have bad periods. And this kind of progressed on. Then it like all stopped for a while. Then it came back. And anyway, by the time I was 19, I was studying herbal medicine, naturopathic medicine overseas. And I ended up in the ER in excruciating pain. That ended up being a bad ovarian cyst. Then it happened again a month later, had surgery. Um, the pain from that point on never went away. So I was having daily pain to varying degrees, sometimes just grumbling, annoying, kind of like menstrual cramps, to just sharp. Then noticing like just puffiness, in my belly, and again, just kind of this moody picture, and something was just not right. And this was going on and on. I bounced from doctor to doctor, came back home to Canada to see specialists. So literally for years, having chronic pain, very strange menstrual irregularities, heavy bleeding, moodiness, just a weird cluster of issues that were really negatively affecting my life, and being bounced from doctor to doctor that was very dismissive. And it was really disheartening. Finally, by the age of 25, I ended up in Canada because Canadian citizen, that's where I grew up. Um, had surgery and was diagnosed with stage 4 endometriosis. Um, so remember, again, I'd been struggling since I was about 14 years old. So
Wow.
about 12 years later, I finally get an answer. And it was a female surgeon. And she said, you're not crazy. You do have, this condition. This explains why you've had all of these different symptoms. And so I was so hopeful because she removed all of these. I guess I should just quickly explain because you may not all know what endometriosis is. Um, they don't know how this condition exactly comes about, but we know that there's definitely a genetic link because you have a 50% greater chance of getting it if your mother had it. My mom did. Um, but essentially, the lining of your uterine muscle has tissue there, and that's what sloughs off every month as our menses. Well, with endometriosis, that endometrial lining actually goes and grows outside of the uterus. It can actually be anywhere in your body, including your brain, your ears, but generally speaking, it's somewhere in the pelvic cavity, like around your intestines, behind the bladder, all sorts of areas. So you have these functional tumors that, like your menses, bleed every month. So you can imagine the pain, the fluid that is creating in all these different areas of your body. So she goes in, she removes these tumors that she can find. And I'm thinking, well, great, like life's going to be good. I'm not going to have pain anymore. Unfortunately, it did not change the pain level. Um, it helped to preserve fertility. So that was a positive thing. So then, at that point, it was like, well, we can give you big bottles of painkillers. Well, I didn't want to do that. Again, I'm already studying natural medicine at this point of my life, and I didn't even want to touch Tylenol or ibuprofen. Now that's a little bit silly, and I don't want to demonize. There's sometimes a need for pain medications, but that was just like my mindset is this young 20
Yeah.
something year old, like, I'm not going to put that in my body. Um, and occasionally, I mean, I had to, but anyway, so this just progressed on. It delayed me getting through medical school at one point because I had to take a leave to have more surgeries. So really, I learned like the medical system doesn't really have anything to offer me. It's surgeries. They offered me a medication, a GnRH agonist that would put me into menopause, okay, and shut everything down for 6 months. I looked at the side effect profiles of that, the damage it would do to my bones, the weight gain, the other side effects, and thought, well, that's not an answer. So I started becoming basically a researcher of this disease condition myself. I was scouring to look at any research I could find. I was reading books on nutrition, on endocrinology. And what I found is that I had to radically change my lifestyle. I had to change the way that I was eating. I had to change what I was putting on my skin.
Hmm.
But I was, around in terms of, even just cleaners, air fresheners, all this stuff, you know, I learned this and I start implementing it. And it wasn't like a magical 1, 2, 3 month turnaround, but over time, as I made these changes, I started getting a handle on the pain, which really was just for me one of the biggest struggles. Um, and then as I continued on in my studies and became a physician, I just had this passion and calling to help other people with hormone dysregulation because I had gone through the ringer with it. It was just years of bouncing around and really being dismissed.
Hmm.
And no one can tell there's something wrong with you just by looking at you, but you're doubled over in pain, feeling horrible. Um, and nobody really is doing anything to truly help. So I did an additional 2 years of study at the end of medical school to get board certified in anti-aging and regenerative medicine with A4M. That's the American Academy of Anti-Aging and Regenerative Medicine. Why I bring that up is they really are just such wonderful pioneers of hormone medicine, really. It's predominantly MDs. There's some DOs. There's, now more NDs as well. But they have really set the standard for training and education in how to help optimize and regulate hormones.
But
Um,
Dr. Tacita, I read that like almost 80% of women are out of balance hormonally. Is that true?
I would say that that is true. I mean, obviously, people are coming to me generally because they have some sort of signs and symptoms. So, of course, in that cohort of people, I'm going to be finding problems. But yes, it is a very, very common issue in both men and women. We're seeing it in teens. It really is an epidemic of its own.
Can you explain like the actual, like just especially for those who are just joining us, what is the difference between naturopathic medicine and Western approaches?
Yeah. Yep. So that's a good question. Um, so in terms of naturopathic medicine, basically you could kind of think of it as traditional medicine. So it's been around for hundreds of years, and it was rooted in, herbal medicine, in food medicine, physical medicine. There's some that will practice the art of homeopathy. But basically it is kind of traditional medicine.
Mhm.
And in the wake of the discovery of antibiotics, which was a phenomenal life-saving thing, that actually kind of led more towards then getting into, well, let's discover more medicines, and the paradigm switched. Um, Now, just to kind of classify in today's world, you can basically be three kinds of a primary care doctor. There's
Right.
MD, medical doctor, we all know, doctor of osteopathy, DO, which got taken over by the American Medical Association. So they're pretty similar now. And then there's ND, naturopathic doctor. So there's about five schools that are certified to educate naturopathic doctors. So we do the same amount of coursework actually as an MD or DO. So you have to do your 4-year bachelor, in science first. Then you go through, it was 5 years of medical school actually, and then I did
Mhm.
2 years of the board certification. So we learn all of the same medical sciences. We still learn about the pharmacology. We can prescribe medications, we can order tests and all of that. But the philosophy of how we're going to be helping to treat the individual is completely different.
And that again is goes back to the fact that you are treating the root problem and not the symptoms.
Exactly. And each
Yeah.
individual person is different,
Right.
right?
So, can you explain like regenerative aesthetics and how and why you focus on clean, pure skincare in your practice as well?
Yeah, yeah. So that was sort of an offshoot. I started out, all right, I'm going to do hormones. Women particularly started saying, well, what can you do, for my skin? So again, coming from the background that I did, being a physician that's constantly doing very in-depth functional medicine testing in urine, in saliva, in blood, I can actually see how a lot of these endocrine disrupting chemicals are impacting people's body. So I was like, okay, well, if I'm going to make recommendation on this, I have to make sure that anything that I'm doing, talking about, prescribing is going to be clean
Right.
and non-toxic, which would mean that it's not going to be promoting endocrine disruption. It's not going to be promoting, cancer down the line. It can't be compromising their internal health just to try to achieve a short-lived aesthetic result.
Now that we're talking about endocrine disruptors, can you explain for those who don't know what is
Yes.
and I also want to start off because there's some people that have joined a little later. That was a big part of why we started Mama Soul because
Yes.
of the fact that in sunscreen is one of the most toxic categories on the market. It is full of endocrine disruptors, especially for one oxybenzone, which was in about 90% of sunscreens on the market when I first wrote the business plan.
Yeah.
But I'd love to hear from you what you classify as an endocrine disruptor.
Yeah, so endocrine, just for anyone that's not familiar, basically that's just the fancy medical word for hormone systems. So endocrine disruptor is going to be something that is disrupting our hormones. And that could be things like oxybenzone that you talked about. It could be phthalates, it could be parabens. There's so many different things that can disrupt our hormones. They can be breathed in, things that are in our environment. They could be topical, getting on our skin, or they could be things that we're eating as well. Um,
Could you share your top tips for avoiding these disruptors in our hormone health?
yes. Okay. So I'll kind of classify it. So first, in terms of, let's talk about skin, because you were just kind of
Yeah.
pivoting the fact that have created some kind of non-toxic sunscreens.
Everybody, if you could just put yourself on mute, that would be great. Thank you. Okay, go ahead, Dr. Tacita.
No worries. So it's important to be looking at the ingredient list when you're, picking up makeup, when you're picking up your moisturizers, your serums, your cleansers, because let's remember that anything that's going onto the skin is being absorbed and that can get into our bloodstream, right? So it's having impacts. It's not just sitting on the skin and that's it. And the list is so long to get into. I think that having, maybe a resource that we could link people to, but certainly you can be looking at the ingredient list. And if there's a bunch of stuff that is chemically that you can't read, that's going to be a little bit of a tip right there, right? Like we should be having oil ingredients that we're recognizing and can read. We can be looking for herbal ingredients that we can recognize and read. So there's just with many products, this long list
Yeah.
of lab-made chemicals that have all these kinds of effects.
What would you
So,
say are the top three like to look out for in beauty
well,
products?
phthalates would be a big one.
Phthalates. Okay.
Phthalates would be a big one. I would look at fragrance. So if you see the word fragrance or perfume,
Yep.
just know that's going to be an endocrine disruptor for sure. Um, Parabens are not great for us either. Um, a resource that I'll often point people to, there's some different apps that you can get. So one resource is the Environmental Working Group, ewg.org. And then there's a new one. Hang on, I'm just going to look on my
Are you
phone here.
talking about yucca?
Um, no, but I'd love to hear about that. There's one
Okay.
that my daughter actually told me about. So it was an app we got on my phone called On Skin. ON Skin. And
Mhm.
so we actually went through Sephora and we had this app because my daughter was like, "Oh, Mom, I want this lip gloss and I want this." And she knows all about what I do
Yeah.
and all that stuff. And she's like, "Can we check the ingredients?" Because I was saying, like, honey, yeah, I want to get you some fun stuff, but a lot of the stuff here is just
Right. Right.
and so she's like, "Well, can we check the ingredients?" And so basically you can take this app, it uses your camera and it goes to the SKU.
Yep.
And then it actually brings up the ingredients and rates it, which was alarming to both of us.
Yeah.
Not
Yeah,
so much.
no, I'm familiar with those types of apps.
Yeah.
They're really helpful. I mean, when you and I spoke, we talked about plastics and how microplastics is a huge part of what is causing not only the men's health crisis, which is an epidemic, but also women's as well.
Yeah.
Um, just if you could give just like some top tips you have for avoiding plastics, because this is the thing. Changing your entire wardrobe and getting rid of everything that's polyester is a little daunting to me, at least.
Totally.
So
Yes.
I want to offer everybody here just some tips that they could make today, this week, next week, this month, whatever it is, that isn't so overwhelming.
Yep. For sure. Yep. And this pivots with the question you said, what are things you can do to avoid chemicals? So we kind of talked about skin. You have some resources you can look up there. So the next thing I would be thinking about is what your food is in. Okay.
Yeah.
So this is both what you're purchasing and what you're making at home. So microplastics and now nanoparticle plastics, which just means they're itty bitty, right? Can really get into tiny cells of our body. Sadly, are in almost everything. We've even now found it in the water. But some big things that you can be thinking about is as much as possible, avoid things that have been stored in plastic. Okay. So if you're going, for instance, to the supermarket and you're getting a bunch of lettuce or berries or whatnot, if you can get ones that are kind of in like a paper carton versus say all wrapped in plastic, that's a great choice.
Yeah.
Okay. Another
Like loose vegetables versus these
right.
bags of plastic. That's what I always try to do too.
And the fresher you can get them. So if you have a place like we have some co-op markets where it's like they partner with local farms, the fresher it is, the better. Okay. So once it's been picked, essentially the plant is dead. And by about a week's transit time, the nutrient density of those foods is way, way, way down. So hence many of these things are stored and traveling in plastic. That's kind of what I'm getting at. Okay, number two, a big one is fats. Fats always have the proclivity to be pulling things in. That's what they
Okay.
do in nature. So if you're going out and you're buying, your olive oil or your avocado oil, you're buying ghee, you're getting coconut oil, please buy it in glass. Try not
That's
to
really helpful. I didn't know that. Okay.
try not to get it in plastic because again, particularly fatty things, they pull out things from the environment around them. So if you are getting your coconut oil in this big plastic thing, it's pulling in those PCBs and PCBAs and all the chemicals that are endocrine disruptors, and it's sitting in that fat and then going into you. More recently myself, I learned that things that are in tin cans
Mm-hmm.
have plastic lining in them. You know,
Yep.
so even the stuff that you're getting in metal, at least in North America now, has been lined often with PCBs, which are a big, well-known group of endocrine disrupting chemicals, or lined with something else comparable. So this is another thing, and this is just terrible because you'll see this on like, baby bottles and all kinds of different plastic things. It'll say PCB free, or sorry, BPA free. That doesn't mean anything. Uh,
Mm.
so basically years
Wow.
ago, what did I say? BPA, all these P's and B's. So BPA was deemed to be a bad chemical, potentially cancer causing, definitely an endocrine disruptor. So it was banned. So all these companies started labeling, BPA free. But guess what? They replaced that ingredient with another chemicals that were in the same family and do the exact same thing. So
Wow.
they
And what
followed.
are those called so we can look out for
So,
those?
so there's BPBs, there's a lot of acronyms. I'm trying to think of the other one here and I'm blanking on it.
We
But
can look that up.
basically there's, yeah, BPAs, there's BPBs, PCBs, and those are just classes. So there's all
Wow.
chemicals underneath those classes. But the point is, if you're getting something in plastic, it's not if, it's just which chemical does it have in it that is problematic. So
Wow. Okay.
that then would take you to your kitchen. So kind of think in your home and in your life places you're going to. So kitchen, right?
Yeah.
If you're storing food, the next time you go to buy food storage, if you've been using, plastic, transfer over to glass or tin metal. For cooking your food, have stainless steel or cast iron. So you want to avoid any nonstick surface, even if it's saying, oh, it's organic, it's green. No, it's not.
Yeah.
Teflon has, again, that's one that's been researched that we know is actually pro-cancer causing and endocrine disrupting. So, it might say Teflon free, but again, these companies are cutting corners and they just go and they find something else that works that hasn't been disallowed yet, that they don't have to label, and they can continue on with their life, and the consumer doesn't know any better. Then I guess the next place I would think of is cleaning, right?
Yeah.
So you're cleaning your own home or you have somebody helping out with that. The products that are being utilized to clean surfaces, to clean our clothes even, are
Yeah.
generally full of a lot of nasty chemicals. Some of them are abrasive and corrosive. Many of them are full of fragrances. So again, anytime you see fragrance or perfume, even if it says natural fragrance, that doesn't mean anything.
Yeah.
Basically, if it's not an essential oil,
Right.
it's problematic.
I will plug a friend of mine launched a brand called Back to Basics, and they have a cleaner called Cleaner Than Clean, and it
Mm.
uses hydrochlorous I'm sure you know.
Hypochlorous acid.
Yes.
Yep.
And so it's actually what our own body makes. And so she puts it on her kids' pacifiers.
That's that
It
is exactly so that's wonderful. And I didn't specifically know about her brand, but I have a machine at home and in my office. It's a machine basically from Japan, and it takes water and it makes different pHs, it ionizes it, it filters it, but you can actually make an acidic water. And basically it's hypochlorous acid, which is
oh,
completely safe. It's just pH magic.
right.
Um, And that's what I have used to clean and disinfect things in our home for
It's
years.
amazing. I mean, I use it for literally everything. I
Yes.
use it on,
Yeah.
we have a new puppy. I'm using it to clean up her
Yep.
pet stains. I mean,
Yep.
everything. So that's a really easy change that I made.
Absolutely.
And then I also was thinking like, even your sponges, they're like releasing microplastics. And maybe today actually, in lieu of us having this meeting, I was like, what can I change today? And because I think a goal that I have now is what's something I could maybe change every day or every week.
Hmm.
And so cellulose sponges was something that I looked into. And I just want to like give some tips because again, this can be really overwhelming to
Yeah.
make a
Yeah.
whole overhaul of your whole life, but
Yep.
small changes.
I agree. And that's what I tell my patients too, you know, because to you and me that where this has been on our radar for years and we've been making changes along the way, it's sort of like comes in maybe second nature. Although I learned something new every year. But yeah, it can be as simple as, well, the next time I go to repurchase a pan or food
Right.
storage or household cleaning items, just make a more informed choice. By the same token, getting super worked up and stressing about all of this isn't really great for our health either. So I love what you were saying, that it's like, what's a decision I can make next? One little thing that I recently learned too. So, many of us might go and get like a takeaway tea or coffee. So I'm now doing my best, if I do that, to transfer it into my mug. So even these paper ones, so this is from a nice little organic cafe just next door to
Yeah.
my office. It's paper, it says world centric, it has all kinds of no tree green, wonderful things, but it still is lined with a waxy plastic.
I'm so glad you brought that up
With
because I've been for so long, I'm like an avid tea drinker and I drink tea every single day. And I was using these, tea bags. And then of course I recently learned that's releasing tons of microplastics into my water. And I'm
Yep.
like, oh my God, like we can't do anything anymore. But
Nope.
now I've switched to loose leaf tea. It is, and I'm using it in my reusable mug
Love
and
it.
then, the stainless steel. And so these are changes that everybody can make. These are simple changes that everybody can make.
Yep.
Okay. So moving on from this, I want to hear you are a hormone specialist and you also specialize in bioidentical replacement therapy. And I think a lot of people want to understand what HRT is,
Yeah.
and why you advocate for them over synthetic options.
Yep. Yeah. So this is a really big topic. So BHRT stands for bioidentical hormone replacement therapy. HRT is hormone replacement therapy. So just kind of a broader. So a good example that I can give you of a synthetic HRT that we would all be familiar with would be oral contraceptive pills. Okay. Certainly they are effective at preventing pregnancy, which is what they're meant to do. Now, those are going to be hormones that are made in a lab, derived from horse urine, made with chemicals. And the structure of those progestins, not progesterone, progestin, is very different than what the structure of our own progesterone is. So when that goes to fit in our receptor for progesterone, kind of think of a lock and key, it's kind of like jamming in a key that got bent. It just doesn't quite work right. It kind of fits in there, but doesn't quite fit right.
Okay.
So the effects that elicits on our body are very different than a bioidentical progesterone. Bioidenticals meaning it mimics the exact same chemical structure as the hormones that we make, and they are derived from plants. So we have lots of research that shows progestins, long-term exposure to progestins, absolutely increase people's risk of breast cancer, for instance. That's just one thing. They can mess up people's cardiovascular health, whereas progesterone, not the case. Same case when we talk about estrogen. Estradiol is our naturally produced from our ovaries main most potent estrogen. We make that during our childbearing years. If I was doing bioidentical, it's going to be estradiol. It's going to exactly be like what we make and fit into that receptor site beautifully. Whereas a synthetic estrogen, same thing as the progestin, not the same shape, not the same effects. So that is a really big, broad topic. And what I can say is there's been decades of misinformation. And the big study, Women's Health Initiative study that came out in 2000, some of you may remember that, but that was a big thing in the community and on the news. Basically, they had thousands of women on different forms of HRT. Okay. It was all synthetic. That's kind
Mm.
of what was the thing back then. Anyway, they stopped the study early because they were having negative effects with like increased heart disease, some increased cancer risk. Well, the researchers involved in that have actually recently had to publish essentially like a redaction of how that data was presented and analyzed because it was very misleading and it's created years of fear about hormone replacement therapy. And we have to be really careful about what type of hormone replacement therapy we're talking about because, again, bioidentical that is well managed and properly dosed actually shows more preventative benefits for heart disease, for cancers, for dementia, for our bones, as
Wow,
opposed
that right there is huge because
it.
I have heard, people having that fear of taking hormones and how it affects your body.
Mhm.
So to hear that your method is actually preventative is so reassuring to me, just as somebody who's about to turn 40. I don't know when I'm going to start going through the changes, but it's really good to know. Could you walk us through the testing and the customized approach you take for
Yes.
hormone health,
And
including like the consultations and the follow-ups and all that?
And this is so important. This is like the message I really want to get out because, hormone replacement therapy now is definitely getting more popular and lots of doctors are prescribing, oh, here's an estradiol patch. Here's some progesterone, there you go. Be on your way. Yay. It is not that simple. And I
Mhm.
want to be clear, even bioidentical hormones, if they are not managed well, if people are being overdosed, could create some harm. Okay. You're putting an outside source of hormones into your body. So when we're embarking on this process, I have an hour-long face-to-face consult with my patients. I do a physical exam. I dig deep into their whole history as
I don't want to interrupt you, but I want
yeah.
everyone to know that Dr. Tacita also does remote sessions as well, which I'm going to be doing with you.
Yeah.
Keep going.
Yes, yes, that is the beauty, Zoom has really opened things up or other technologies for that. So we can have remote consults. But my point is it's extremely important to really know my patient's full medical history, their family history, their stress levels, all of those things. Okay, so we get that information, then we're going to be doing very comprehensive blood work. Okay, not just looking at a few things that they would check in an annual physic. We're talking like a long list. um, Everything from full thyroid panels to cardiovascular markers, inflammatory markers, autoimmune disease markers, certain
Mm.
nutrient markers, and of course, any hormones like testosterone, thyroid, those test well in the blood. When it comes to our estrogens, we have three kinds of estrogens, and our cortisol, stress hormone, and our progesterone. Our estrogens and progesterone in particular, throughout the month, as we all know, are doing all kinds of fun things.
Yes.
It's like a neat little roller coaster ride, right? So if we take a blood test of estrogens and progesterone, it literally is just saying, okay, in the moment at that very time, that's what the hormone level is at. That doesn't really give me a whole lot of information. So you always need to be doing either urine or saliva testing for those sex hormones because the way that the hormones are circulating in those fluids, it gives us much more information and accuracy about, where are your estrogens? And not only that, it actually shows us the metabolites, which are the breakdown products that our liver makes in processing those hormones out and clearing them. And this is where the big kind of risk reduction comes in. So a test that I commonly do is called the Dutch test. And I have no relationship with them. I'm just saying this because it's a great educational piece. So it's a urine test kit you do at home on a specific, time section of your cycle, if you're menstruating, if you're postmenopausal, it's anytime. It not only shows me where the levels are at, it shows me how they're breaking these hormones down. And for instance, with estrogen, there's one pathway called the 4-OH pathway. If you're dominant or too high in that pathway, we know from mounds of research, there's an increased risk of cancers, reproductive cancers, heart disease, and bone degradation.
Wow.
Okay. You know how many women I've had come in that have been on oral contraceptive pills for years, or somebody has foolishly given them oral estrogen? They come in, those are the ones that have that high 4-OH. Those are the ones that go on to get problems. Okay.
Wow.
When we're doing bioidenticals, so when I get them cleared of that, we shift gears, we look at their levels, we start low dose, we
Mhm.
slowly move up. That picture on retesting is completely different.
Can you tell us some, and I, because we're going to jump to women's health, perimenopause, PMS, the difference between perimenopause and menopause, all those things.
Yeah.
But I do want to just touch on for all of those who are in relationships and are partners, what the
Yes.
men's hormonal health crisis. So you've mentioned an epidemic in men's hormonal health and
Mhm.
what environmental factors contribute to this decline and how do you approach this treatment? And I guess what kind of changes do your male clients typically experience when they do hormone therapy?
Okay, sure. So first, just to kind of lay out kind of the epidemic that we're referring to would be quite specific to testosterone. Okay, that's like the dominant male hormone, right? If you looked at levels of, for instance, total testosterone in 1960 for a male, it was like in the 800 to 900s. That would be like a typical total testosterone. When you look at it now, and I'm not talking about old men, I'm talking about men who are coming in their 30s, they're coming in their 40s.
Right.
It is very common to now be seeing ranges between about 200 and 400. Okay.
And what does that do to the man?
Yeah, I mean it does a lot of things, but in their words, the complaints that I hear is like, they're like, I just don't have the same motivation and like the vigor I had. And I'm getting a bit fluffy. I'm gaining weight. I don't feel as strong. My libido's down. I'm having some erectile dysfunction. Their cholesterol goes up. Their blood sugar goes up.
Wow.
They're more
Okay.
moody. It's like the andropause picture. Um, so so it's not just about like their muscles and their libido, but it's all of this internal important like risk prevention stuff for heart disease, for prostate cancer, all of that kind of good stuff. Um, so it's, then leading to, well, why is this? Okay. We do know that there's far more exposure to all kinds of chemicals like we've talked about, whether it's going into our system through, skin products, we're breathing it in, it's in our water, it's in our food. And obviously we can't just live in a bubble and not eat or drink anything, right?
Yeah.
So we do what we can, but getting these levels tested and then making some important lifestyle changes can be very helpful. So the types of conversations I have with my male patients in this kind of situation, it's like, okay, well, like, what are we eating? I always do a very big diet recall. Well, many of them are doing kind of the convenience foods, the pre-made things, the packaged stuff. So it's like, okay, so how can we still make your life work, that you can do the things you need to do, but make some changes. So I often will start with about a 21-day kind of detox protocol, where we're trying to release some of those endocrine disruptors from their system. Sweating is a big plus for that, whether it's sauna, hot tub, or just working out and getting really sweaty. We're trying to move towards a more whole foods, less processed type of lifestyle. We're wanting to reduce alcohol because that converts testosterone into estrogen.
Oh,
That can be another piece.
okay.
And they need to exercise, getting their muscles activated, believe it or not, being around other men that can actually spawn more testosterone production. And then in many cases, we do move into a bioidentical hormone replacement, optimization for them. But I always, always, always first start with, okay, we got to make some changes in the lifestyle. We got to be exercising. We need to be eating, reasonably well and see what improvements we make. I had this was an interesting case, a man who was about 38. Um, his total testosterone was in the 300s, so very low. He was super dedicated, like changed his nutrition. We got his blood sugar down. He started working out. He cut out alcohol. He did all these things. I gave him some herbs that also helped with his liver and his testes. We doubled his testosterone.
And how long?
It was about a 4-month process.
Wow.
Wow.
And he like was really dedicated. He put a lot of effort into this.
What did he experience? We have a lot more topics together, so I want to keep it. But tell me, what did he experience after
Yeah.
that
Well,
doing that?
a big one for him was he said that his mood and like the relationship with his wife and kids really improved because how he put it, he's like, I was very cranky
Mhm.
and just easily
I'm
triggered.
sure a bunch of us can relate to that.
I was like, Arielle's definitely doing some hunting here.
Um, so okay. So I
And he
want
lost
to,
weight
what was
too,
that?
he lost weight. So he just felt better about himself. And he also had reported that like his work became, it was just more successful around. He was more focused and energetic. So
Yeah, that's really helpful.
yeah.
So we were talking about detoxification for hormone health. Can you just give us just like a quick high level, what are some things that people can do today if they wanted to start detoxifying?
Yep. So a big part of this detoxifying process is going to be aimed at supporting the liver. So some things that you could be doing is cutting back or eliminating alcohol for at least a period of time. I would be looking at lowering and avoiding processed foods and ultra processed foods. So if something's being purchased in a box, right? A package and it's got big ingredient list, it's not fresh, that's like a processed food. I would be looking to cut back refined sugars and added sugars. You could start sipping on milk thistle and dandelion tea. That's readily available. That's going to just be a gentle, herbal support for the liver. Exercise and sweating. Now I know many people are super busy and for me too, like this can be a hard thing to fit in sometimes as a working mom. Um, but any opportunity to get a good sweat in, that's helping to release these microplastics and chemicals that we store in our fat cells. That's, by the way, where our body likes to store a lot of toxins is in our fat, because often our body's like, I don't recognize this molecule. This does not seem like a good thing. I don't think I want to put that all through my kidneys and my liver. I'm gonna go plug that in fat. So anytime that we're heating up, we're losing some weight, we're
Like the
sweating.
sauna.
Yes, sauna is absolutely fantastic. I know not everybody has access to that. So I just want to say you can still go take a hot bath and put
With Epsom salt, you mentioned, right?
Yep, Epsom salt's a good way. So that's like an economical, easy way that pretty much anybody could do. If you didn't have a bathtub, hot shower, and again, if you can cover your head up to kind of retain some of that heat, that's a good thing. Exercising with, a bit of a bundle of clothes on, that's going to get you sweating. If you have access to a sauna, that's phenomenal. That's great. But those are some ways to get it out. Drinking plenty of pure water. And I'm not talking about carbonated water, by the way. That is actually acid forming in the body because we've added carbon dioxide to it. So we're talking ideally filtered, pure water. If you don't have filtration at home, I would still say drink tap water over going and getting bottled water. Let's remember, bottled water is largely in plastic or metal that's been coated in plastic, and it's been sitting there probably for months,
Yeah.
probably heated. Anytime something's heated, that's releasing the chemicals more. Feel like I'm getting off track here. Did
No,
I
that's okay. No, this was really helpful so far. So then because we talked about nutrition and
Yes.
and for hormonal balance. Is there anything that you didn't mention for nutrition that you want to add?
Yep. So as much as possible, whole foods and fiber-rich things. Fiber-rich foods, high in nutrients, are going to help to pull stuff out and
Can you
clear
give
it out.
some examples just so people?
Absolutely. So like right now, root vegetables are in season. So go get some potatoes, some sweet potatoes, some winter squashes, roast them in your oven, eat them, order them when you're out. Broccoli and cauliflower, Brussels sprouts. Those are things that can be particularly great for the liver. I recommend cooking all of these foods, by the way. That's much easier on digestion.
Rather than eating them raw. My
Yep.
husband always,
Yep.
he's encouraging me constantly to eat the broccoli raw. And I'm like, I want to cook it.
No, it actually, there are some foods that actually have anti-nutrients in them unless they are heated. Spinach is one of them. Kale is another. So I'm actually a
Oh,
pretty big proponent for many people, not everybody always, but to at least lightly steam, stir fry, cook. I'm not talking about boiling the hell out
okay.
of them.
That's really,
You know,
that's good news. I didn't even know that. Okay.
yeah.
Mental health and hormones. Well, actually, before we get into mental health and hormones, what I think a lot of women want to understand is perimenopause, because a lot of us are, okay, somebody asked, so spinach in a salad isn't good?
Well, I don't want to say that isn't good, but I just will say that you can even get more out of your
Right.
spinach.
I'm like listening to
Kale
something
by
David,
about
sorry,
hormones
can you put
and
yourself on mute, please? Sorry.
um
What did you say?
if you can lightly massage those greens or steam them, you actually, believe it or not, do get more out of them, and you're ridding some of those anti-nutrients. So I don't want to say that eating a spinach salad is bad, but I am going to just say that
It could
there,
be better if you steam it. Good to
yeah,
know. Okay.
yeah, yeah.
So perimenopause and PMS and the difference between perimenopause and menopause. How can women recognize symptoms of perimenopause and
Sure.
what treatment options are available for managing symptoms like anxiety or sleep disruption or skin changes?
So perimenopause is about a 10-year fun process where we are entering the stages leading up to basically our ovaries declining in hormone production and getting to a place where we're eventually going to be post-menopausal, which is going to mean that you have not had a menstrual cycle for 12 consecutive months. In our perimenopausal phase, that can begin as early as the 30s for some women. Other women, they may not start that till their late 40s or early 50s. I do see it happening earlier than what we used to. Some early signs can be that your periods change. So often there's actually a chunk of time earlier in perimenopause where the flow gets heavier than it was.
Mm.
And then our cycle starts to shorten, meaning maybe it used to come every 28 days. Now it's coming every 26 days, every 21 days. So you kind of go through this phase where they're shorter together, happening more frequently. Flow can be heavier.
Mm.
Then it kind of shifts again, and it starts to lead into like getting a bit lighter. And then 1 month you don't have one. You've skipped it. And you're like, well, that's weird. Then it comes back. Then you might skip 2 or 3 months. Then it comes back. It's kind of this dance of up and down. It is common to have anxiety, increased moodiness and irritability, sleep problems, which could mean waking up in the middle of the night. It could mean having hot flashes, night sweats, vaginal dryness, weight gain is common. Those are the biggest signs and symptoms that people come to. And during perimenopause, the fluctuation, with estrogen, where it kind of used to do this, it actually starts having far higher peaks and far lower valleys.
Got it.
So
and at that point, you need to see a doctor because you have to get your hormones in check.
yep. And I honestly would recommend doing it earlier in the process than later, because data is now showing, plus clinical experience, when we can start earlier in the process with getting things regulated, it's a much less traumatic process for the patient to have to go through. But also we can get on top of protecting the heart and the metabolic regulation, so blood sugar and your lipids, your cholesterol. We can be getting on top of protecting the bones.
That's really helpful.
And then that influences the skin and stuff too.
For women with PMS or estrogen that are estrogen dominant, what lifestyle and nutritional adjustments do you recommend for them?
Yep. So estrogen dominance is very common. For that, again, liver is often going to be a really big organ that we're looking at, as well as the gut. So avoidance of alcohol is a big one. Really limiting sugars, added sugars. So starting your day off with protein is a really paramount thing, because that first meal of the day is sort of setting the stage, so to speak, for what our blood sugar and insulin regulation is going to look like.
Yeah.
And that does influence our estrogen. Exercise is helpful in trying to stay a little bit on the leaner end. And the reason I say that from a health perspective is that when we're carrying excess fat, it actually acts as an endocrine organ. So it will actually produce more estrogen and cortisol, two things that end up not making us feel so great
What did
mentally.
you tell me what you called it? An endocrine
It acts as an endocrine organ when we
organ. Okay.
overweight or more so obese. That extra fat tissue is actually producing hormones itself. So that can just mean like getting some help with working towards a healthy weight for you. Okay. So supporting the liver, eating more whole foods is going to be helpful. Getting an exercise. I'm a big proponent of weights. So keeping your muscle tone up is important.
Yes. That's really helpful. Okay, so we have 5 minutes. I want to talk about a few. We had at least 21 people sign up. Not everyone can make it. I understand with their schedules, but I want to ask their questions. So,
Yeah.
one of the questions is, what is the best way to ensure fertility into your 40s?
Oh boy. So I'm just going to say that really varies from person to person.
Yeah.
There, I know of patients who do great and they can have babies in the 40s, but I'm going to be honest that it is true at 35, we do see a decline in quality of eggs. Okay. Now that can vary from person to person. By the time we hit 40, there's a very steep decline. By the time we hit 42, 45-ish, again, this is, based on statistics averages, egg viability is pretty low. So it is exceptional for somebody to get pregnant naturally, well into their 40s. But we all have those friends, right? So
We do.
not
I
important.
my neighbor's 50 and having her for second.
Yes. So it can happen. What
Yeah.
I would say is it's like we're looking at egg quality there.
Right.
So we have some control over that in terms of, again, it comes back to the same lifestyle stuff that we've been talking about. So
Right.
trying to stay fit and healthy, eating more of a whole foods based diet,
Yeah.
keeping our blood sugar regulation up, our exposure to chemicals. Like in non-modern societies, women are often menstruating into their 60s.
So another question, this is a little more specific, so feel free to just answer it as quick as you can, just because we are short for time.
Yes.
Are hormonal changes affecting my hips and knees? Getting significant increase in pain out of nowhere. Been told to see strength in training and do PT. Wondering what I can do to see if my hormones are contributing to the degradation of my muscles and my
Yep. Yep. So I'd recommend finding a practitioner that can do good blood work and urine testing, like the Dutch test or something similar. It's very common that, particularly as estrogen is declining, we start getting more aches and pains. Progesterone can affect it too.
That's great. Okay. How do you reduce adrenal fatigue?
That can be quite a process. So just to be straight to the point, part of it's going to be lifestyle stress management, catching up on sleep, anything from prayer, meditation, sunlight exposure, whatever kind of soothes your soul, right? You got to get the stress down and manage it. Internally, that could be looking like adaptogenic herbs, which is a whole class of herbs that help to nourish and strengthen the glands. It could look like detoxification for some people. It may mean for people with serious adrenal sufficiency going on bioidentical cortisol, which is hydrocortisone. But a big thing is going to be stress management and then getting in the right nutrition and herbs.
Great. What age can somebody start hormone replacement therapy?
It depends on the person. So I would never put an age to that. It really is about, okay, what are their signs and symptoms? Then do testing to see, right?
I guess if somebody was like my teenage daughter, something like that, how early is too early?
Generally speaking, I would not be prescribing hormones to a teenager. Having said that, there could be some instances like endometriosis that's severe,
Right.
Estrogen is so dominant that you would maybe come in for a portion of the month with some bioidentical progesterone. I will also say for PMS, doing progesterone mid-cycle can be very helpful, and that could be in younger patients.
That's really helpful. Okay. I'm going to pick one more question because there's honestly there's too many to get through. Somebody asked, can you discuss the difference in hormonal needs for patients going through peri and menopause? Have you seen any advancements in non-invasive testing methods for hormone levels that you find promising?
Yep. So from when I first started practicing, the testing has gotten far better. So the Dutch test I talked about is one that I pivoted to because of the organic acid testing that they do and the metabolite testing that they do. That's a big advance I've seen. There's also saliva testing, and that has its place too. But really just the big take home is you want to be doing a combination of blood and saliva or urine. Ideally,
Okay.
all three is great if you can.
Somebody has to jump. We loved having you. Thank you. So to wrap this up, thank you everybody so much for joining. And just to remind anybody who didn't catch the beginning, I am Arielle. I'm the CEO and co-founder of Mama Soul. We are creating a community for everybody to join that we are going to be talking about spirituality, health, wellness, all these things. And so you can join us every month. We're going to have a different expert, incredible, just like Dr. Tacita. And every single time that we have one, Mama Soul and our guest is going to offer something to somebody that stays until the end. So I'm going to pick somebody. Okay, Lauren Maddock, you have won. Dr. Tacita is offering 2 sprays or a spray. You tell us what it is, and you're going to receive.
I'll try to make it quick. So there's 2 sprays that I have developed years ago. One is called Balance, which is about a 6.0 pH balance with organic essential oils. And basically it just helps to really hydrate the skin, tone it. You can put it over top of medicine or makeup, underneath makeup. And we send patients away with it post-procedure. So love, 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 love it. And then the second spray is called Spot On. It is a hypochlorous acid-based spray that I developed about 9 years ago. It also has essential oils. So all these products are completely chemical-free, organic. That one I actually use for everything from acne to psoriasis to my kids, wounds to hand sanitizer, as a great post-workout spray to reduce breakouts. So they're all really based on the magic of pH as well as some essential oils.
So Dr. Tacita is going to be soon launching these on her website. I'm not sure when that will be ready, but
maybe probably January.
You'll be able to purchase those then. But somebody else is going to win something here. So Mama Soul, as you guys know, is a 100% mineral sun care brand. We have a face sunscreen, a body sunscreen, and a tinted lip oil with SPF. I'm going to pick somebody that is going to win. They get to pick. You can pick anything in the line. I'm closing my eyes. Anna P. Are you there?
Yes, I'm here.
Okay, so you get to pick something in the line. I'm going to email you, and you can just email us back and let us know what it is that you like. But for everybody else who did not win, one of the gifts, Mama Soul is offering a discount code to the site. It's Balanced Mama 15. I'll email everybody. Balanced Mama 15. You can get 15% off of anything on our site. It's really important to protect your skin, no matter if it's sunny or not. And Mama Soul is approved by Dr. Tacita, is not a endocrine disruptor. It's super clean. And it's also the face and the lip are stored in glass, and the body sunscreen is actually in sugar cane. So there is no petroleum-based plastics that's storing the products. So I hope that whether it is your skincare, whatever you're using in your kitchen, your bathroom, today inspired you to make a change. And also, if you have more questions, I'm going to link you to Dr. Tacita's Instagram page. She has so many amazing tips that she shares. And if you have any questions, you can always email me too. Dr.
Yeah, and
This was amazing.
thank you so much for having me, and nice to meet you all remotely.
Yeah, no, you are seriously amazing. I'm so excited. I feel very inspired to make even more changes. So thank you guys so much for coming, and I'll send everybody the recording in case you wanted to watch back.
Thank you, Mama Soul.
Bye, guys.
Bye.